Hello, everybody. First of all, thank you very much for this kind invitation. I would like today to speak about the impact of mental health on the quality of life of people living with HIV infection. In 2013, UNAIDS created and launched a very ambitious plan. The idea was that 90% of people with HIV infection were properly diagnosed. Among them, 90% would be receiving a proper antiretroviral treatment, and 90% would be virally suppressed. This was the plan that they had for 2020. Years later, a group of researchers, headed by Lazarus, published a paper which reflected upon some difficulties that people had to face in their daily livings and that might affect all this idea of a correct follow-up. They mentioned the high burden of comorbidities. They mentioned the fact that thanks to the treatment, people were aging properly. And they proposed the idea of a fourth, 90%. In this case, describing a good quality of life. So the idea was not only to prolong the life of these people, but also that they could have the right to live it intensely and properly. However, long time ago, the term quality of life had already merited the attention of the scientific community. As you can see in these graphs, practically since the beginning of the epidemic, the term quality of life has been appearing and increasing in the scientific communications all around the world. So when you try to find information about quality of life and HIV, you have a lot of scientific material, also regarding mental health and HIV. But when you try to find reports, information about quality of life, mental health, and HIV, this number of papers decreases importantly. But what is quality of life? Quality of life has been defined according to World Health Organization as an individual situation that allows people to live in a good context regarding culture and value systems, and in relation to their goals, standards, expectations, and concerns. The term health-related quality of life is a term that has appeared later, and it is a concept for which there is an unaccepted definition yet. However, two aspects seem to be central in all the definitions that we find about this concept, which is that it is a multidimensional concept that wants to englobe well-functioning, physical, social, psychological aspects of well-being and functioning. And also it is a context that can include objective and subjective perspective in each domain. And this is different to the main concept of quality of life. So when you try to find information about this concept, you find multiple factors that have been described, and you find multiple models that have been described as well. For example, here we see four major domains that have been appearing very often in many studies. We have physical domain, psychological domain, social domain, and environmental domain. Physical domain refers to aspects such as the impact of the disease on the activities of daily living, fatigue, mobility, pain, discomfort, quality of sleep, lack of energy, perceived working capacity, while psychological domain would include as well perceptions about body image, appearance, negative feelings, cognitive function, body image, spirituality. Social domain would mean the personal relationships, the social life of the person, the sexual activity. Environmental would mean from financial status to social care quality, accessibility to social care, etc. And regarding models, here we have an example of the Wilson and Cleary conceptual model, in which they define that overall quality of life would be mediated by biological and physiological variables, symptom status, functional status, general health perceptions, and all of them would be also mediated by characteristics of the individual and characteristics of the environment, without forgetting the non-medical factors. So as you can see within the concept quality of life, we can find many subconcepts that conform a very complex universe in which we can highlight the disease, medication, stigma, poverty, sexuality, side effects, addictions, acceptance, chronicity. What do we know about mental health in people living with HIV infection? We know without any doubt that the prevalence of mood disorders is very high. When we talk about mood disorders, we mean especially depression and anxiety. We know that the percentage of people who report this type of symptoms is usually higher than in general population. Here you can see an example. We know as well that an important number of people may have at a certain moment of their life a problem with the abuse of drugs or alcohol or smoking, and that this abuse is often a manifestation of other emotional disorders. We know as well that there is a high prevalence of post-traumatic stress disorder, and that this prevalence is comparable between high income, low income, and middle income countries. There is another concept that is also very important when talking about mental health in HIV, which is stigma. Stigma considered enacted, so the one that is coming from outside, and internalized, the perceptions that we have. No? The definition of stigma refers to stereotypes or negative views towards a person or group of people when their characteristics or behaviors do not match or are considered inferior to societal norms. When we talk about stigma, we can have the problem that apart from stigma, we can add other concepts that may increase this negative impact of the stigma, like for example, ageism. And it is important to think about this concept because now we have a very high number of people who are aging thanks to the medication. And in our society, apart from the fact of the HIV infection, there is this concept of ageism. It's a stigma towards getting old. No? Ageism would be defined like negative attitudes, stereotypes, and behaviors that are directed towards older adults based solely on their perceived age. So, considering this panorama that is already difficult, where the presence of mood disorders is quite high, now, just to cap this off, we have a global pandemic. How is this pandemic affecting the mental health of people with HIV? Well, we can think that poor baseline mental health is likely to be exacerbated by social all the policies that are taking into account, considering the restrictions, the physical limitations. No? For people with already diagnosed mental health disorders, the social and physical distancing restriction and also the transition to the telehealth care might lead to difficulty to receive or engage in behavioral treatments for these mental disorders. And we can also think that people with severe mental health disorders might be at a higher risk of COVID-19 because they don't understand the risk or because they don't know how to mitigate the effects. So when we think about factors related to mental health manifestations, such as stress, depression, anxiety, we can see that all these factors may affect physical and psycho-emotional impairment through two different mechanisms. On one hand, we would have direct mechanism that would be behavioral variables, and on the other hand, we would have indirect mechanism that would be psychoneuroimmunology. Regarding the direct mechanism, we can include aspects of care like adherence to antiretroviral treatment, adherence to medical visits, to have a good clinical advice, because maybe there is an impaired communication between the healthcare professional and the patient, unhealthy habits such as bad nutrition, drugs. Now, for example, we have the difficulty of chemsex, alcohol, smoking, sexual risk behaviors, and a lack of social support, isolation. And when we talk about the indirect mechanism, and we mean the concept psychoneuroimmunology, we often speak about the influence of three main systems, which would be nervous system, immune system, and endocrine system. Thanks to studies already developed, we know well that stress is a contributor of the development of inflammation and associated diseases, decrease in CD4 cell count, worse response to antiretroviral treatment. And regarding depression, it causes an immune suppressor effect with a decrease in natural killer cells, a decrease in lymphocytes, and worse lymphocyte function and inflammation as well. Regarding stigma, which is this concept so present in this disease, we know that it has been established in many studies that has a clear impact on the HIV epidemic, and it can be a very important barrier to the HIV cascade in all the different phases of this cascade, since the diagnosis, where you can find that because of problems of rejection or fear to know, the person cannot be properly diagnosed, passing through the inclusion in health system, where there can be distrust, fear to disclosure. Regarding retention in care, there can be a fear to be seen and a fear to be identified, which makes the person not to follow the treatment properly, not to follow the visits properly, and at the end, not to adhere properly to the treatment. So stigma may mediate very importantly how the person is taking care of their health. When we talk about mental health and quality of life, there is a concept that very often is missing in all the studies and investigations that are done, and this is gender perspective. Regarding this, we wanted to study a bit better if really people differed very importantly regarding their quality of life if they were men or women, something that appears to be quite simple. No? And here you can see some of the information that we found in a study that we developed in our team. As you can see, we assessed what variables were really important for people when they described a good physical or a good mental health. And you can see that regarding physical health, some variables were considered between men and women, which would be having had opportunistic infections, having antidepressant side effects, but others were very different. For women, for example, a worse physical health was related to the fact of being diagnosed before more years ago. And if they perceived a personal experience of rejection, which is considered an active stigma. While for men, for example, having injection drug use as HIV transmission route determined the physical health. Also, be employed was positive, was a protective factor. To have a bad mental representation of the disease, to have economic worries, to have a dissatisfaction with body image. All these seem to be very important when men reported the variables that influence their quality of life, but for women, it wasn't like this. And when we talk about mental health, as you can see as well, they coincided as well, men and women, in having had opportunistic infections. They coincided as well in the stress that they associated with the fact of being HIV positive. They coincided as well in a negative representation of the disease. But as you can see, others as well were very different, because for women, for example, the fact of having a low CD4 cell count was something that affected them emotionally. Maybe it was an important reason of worries, not for men apparently. While for men, it was valorate it as something very positive, to have a sense of personal autonomy, a sense of personal meaning. For women, it wasn't so important. For women, it was important, a high concept of self-esteem that didn't seem to be so important in men. So the idea that I want to transmit to you is that when we evaluate these terms, it is also important to consider this gender perspective, because what can be important culturally, socially, emotionally for a man may be different than for a woman. So considering the situation, the fact that people with HIV infection have to face important emotional difficulties that affect their quality of life, what can we do? How can we help? Well, first of all, now we are using every time more, and it's very positive, patient-reported outcomes. These patient-reported outcomes should include mental health and quality of life. It can be a very good opportunity to have information about these aspects in our patients. We know as well that interventions are effective for mood disorders. We have an important volume of studies that have shown that psychological treatment, support psychotherapy, problem-solving therapy, peer support counseling, mindfulness, meditation, yoga, and also exercise, both aerobic and resistance, may produce a very positive benefit on mental health. There is also a need to develop well-designed interventions that document stigma reduction, because stigma is a concept that is very frequent in our discussions when we speak about mental health. But when we try to find interventions that have been appropriate and have been useful to reduce this stigma, we have limited literature. So it is important to design intervention studies to work precisely on this concept. Because as well, apart from this reduction of stigma, we have many studies that have determined if these interventions reducing stigma have benefit on the quality of life of these patients. So the conclusions of my presentations would be: quality of life is now a determinant factor when considering the global status, the global health of people living with HIV infection. Mental health affects quality of life through direct behavior and indirect, which is called psychoneuroimmunology pathways. And there is a range of useful interventions that have shown to be successful, improving mental health and, as a consequence, quality of life. Thank you very much for your attention.